After hours in East Nashville. Many people go without health care here. But 6 years ago, Vanderbilt medical students opened an after-hours clinic in this area, completely student and volunteer run, and completely free.
Walk right in here, we can have a seat.
Gilberto Morales, who used to attend Shade Tree's clinics in their tiny, cramped, rundown trailer just about a mile away, says Shade Tree changed him, improved his life.
Obviously, a bunch of patients have started to arrive, so I'm going to go get their charts together and hand them out to you guys.
But things have changed for Shade Tree, too.
How are you?
Just
Good
fine.
to see you.
Glad to see you too.
Welcome to our new home.
Well, you look pretty.
Yeah, what do you think?
Much improved.
Yeah.
Shade Tree has now moved up the street, up in size, functionality, and curb appeal, but one thing remains just the same. The patients and the students here have a relationship that serves as a model of teamwork.
I do believe that there were more clinics like this. People will be more eager to come to doctors and take care of themselves. Because there's a lot of people that want to take care of themselves, but don't have any place like this, where to come.
Just after 6 p.m., the hallways are bustling with students as well as top physicians from the Vanderbilt University Medical Center who offer guidance and support. Clinic visits for patients like Morales are true primary health care visits. But there is more.
I'm Vanessa.
How you doing, Vanessa?
I'm a patient health educator.
Students in a patient health education program, or PHE, advocate for patients and they teach them about their chronic conditions.
We've tripled the size of the patient health education program to include all of our patients with chronic disease, including respiratory, heart disease, as well as diabetes.
A research project based on the PHE program is underway.
The idea is that a patient could hopefully finish this curriculum, assuming they show up to appointments and all that stuff, in a year, and then we're going to do a post-quiz measuring how their knowledge of the disease has changed.
So last time you were here, we talked about exercising.
Already, students have evidence of both successes and challenges. Diabetic patients have a goal of keeping their blood sugars low, but that has proven to be difficult.
Let's do some concrete numbers. How many times a week?
Let's do it 2-3 times a week.
Hi, how are you guys doing today?
Another goal is to educate about the risk for pneumonia and to vaccinate to prevent it. Last spring, about 36% of patients had the vaccine at Shade Tree, but 7 months later, it was approaching 60%.
I've walked from here to that door without running out of breath.
Tina Stevens is enrolled in the PHE program for chronic lung disease.
And I check in with them all the time here, you know. I was having appointments like every other week to start with.
You don't have any questions, you're not having any trouble with using your nebulizer, it's not interfering with anything, you're able to do it just fine and all of that.
Now Stevens is able to walk longer distances. She says she feels much better.
Without this, I don't know where I'd be. I mean, because I don't get any kind of medical, I don't have any kind of medical. They're doing it all for me.
But students say the patients do the hard work. Aside from the free price tag, Shade Tree offers regular access and energetic coaching.
It reminds me about my duties as a diabetic patient, and I listen.
And the research Morales and others participate in may provide important evidence that even in neighborhoods with less access to health care, partnerships, education, and caring can lead to better health.
They keep me in track.
For Viewcast, I'm Carol Bartu.